Patrick Commiskey here in Albuquerque, New Mexico. This is a pterygium, a common problem in the American Southwest. I always start with the sub-Tenon block, very safe, very comfortable. Then removing the head of the pterygium and trying to peel it off best we can. Whatever is still there, we can always polish. Then the main part of the disease of it is this underlying tenons, where the layer underneath the conjunctiva, the pink of the eye, becomes inflamed and sort of grows over the cornea. So we have to remove that underlying tenons. Here we're using a diamond burr to polish the corneal portion. We want to make that as smooth as we can. Sometimes there's still a little bit of a scar left, but we want to polish up as nicely as we can. We use a little bit of cautery to control any bleeding there. And then we harvest a conjunctival autograft from under the eyelid. I mark it with that blue dye just so I can keep track of the orientation, make sure that the right side is up and the wrong side is down. So we make a nice smooth graft there. There's still a little bit of oozing there, so touching it up with a little bit more pottery. A little bit of blood's not too bad, but a lot of blood can, kind of get underneath the graft and be bothersome. So here we're sewing in with 10-0 Vicryl. This is like our smallest suture. It's very small, very annoying. You can barely see it, but we use it because it's the most comfortable and creates the least amount of inflammation for our patients so they can heal nicely. At our downtown hospital, we can use fiber and glue, but it's just not something that's available to us in our ambulatory surgery center. So it takes a little bit longer time to use the 10-0 Vicryl, but the result is quite nice with it. I like to put in several sutures here to make sure that we close any gaps so that the conjunctiva is well opposed to the graft and can kind of heal smoother. At the very end, we'll place some injections of an antibiotic and a steroid to help prevent infection and also help start the process of healing without making more scar tissue with the steroid. I tell patients that their eyes will be red and scratchy for several weeks after surgery, maybe 3-4 weeks, as the graft heals and the little stitches dissolve. We give them steroid eye drops and antibiotic ointment to help soothe the eye, make it feel better as it's healing. But this will heal in really nicely, and the patient will have a good cosmetic result and not have so much astigmatism from the pterygium kind of growing over the edge of the cornea. Sometimes we have patients that do this pterygium surgery and then cataract surgery down the line. I typically wait 3 months after the pterygium surgery before remeasuring the eye to determine, what the best power of lens is and how much astigmatism is there and so forth. Thank you for watching.